Well, good afternoon, everyone. Across Ohio, our children are starting back to school. Football games, cross-country meets are just days away. I think Ohioans are united in wishing that all of our children have a great school year. We hope, we pray that the kids will be able to stay in class with in-person learning without interruption. It is because of that goal today that I'm holding this press conference. Dr. Vanderhoff and I are doing this. That goal of having our children in school in person is now being threatened, even as school is just now starting. That goal is now clearly at risk. Today in Ohio, we are facing a perfect storm. Just as our kids are back to school, the new Delta variant is sweeping across our state, taking direct aim at all those who are unvaccinated. Dr. Vanderhoff and I are here once again to lay out the facts of where we are in regard to the virus in Ohio. Sadly, things have worsened since our last press conference. And today we want to reiterate the recommendation that the State Health Department made 10 days ago, that school children be vaccinated or wear a mask while in the classroom. These steps will give them, by far, the best chance of staying in school. Now, we know that most of our school kids are not vaccinated. We know that children 11 years of age and younger can't yet be vaccinated, and that those 12 to 17, of those, only 35% of them are currently vaccinated. The spread of the Delta variant has dramatically accelerated since I last spoke to you 10 days ago. We are at the highest level of cases since last February. Today, we're reporting 3,235 cases. Now, to put that number in context, we've had 3 days in the last week with over 3,000 newly reported cases. Prior to this week, we haven't had a single day with over 3,000 newly reported cases since February. To show you how fast the virus is accelerating in Ohio, listen to this. On July 7th, our cases were at a very low level of 17 cases statewide per 100,000 people for a 2-week period. 17. Today, that number has gone from 17 to 236. Every county in the state is now considered a high incident county. If we look at cases per week over the past month, they went from over 2,000 during the 4th of July week to over 13,000 last week. That's over a 500% increase in cases. Today, there are 1,571 of our fellow citizens hospitalized in Ohio with COVID. Like case numbers, this is the highest since last February, when we had 1,571 patients in the hospital with COVID. Additionally, there are currently 464 people in ICUs in Ohio with COVID. This is the highest number again since last winter, specifically last February, when 466 patients were in the ICU. Now, we're clearly well past the time when the state can mandate to parents, to local school districts, to parochial or private schools, what actions to take. These decisions today rest with each parent, rest with the parents, and it rests with the school officials. But I believe we have a moral obligation to lay out to the people of Ohio, to those parents, those school officials, the facts. And I think it would be wrong It would be irresponsible for us to not give the parents and school officials the information that we have to help them make informed decisions. So I'm speaking today directly to every parent, every school official, every school board member in Ohio, public, private, parochial schools. The best way to make sure a child can stay in school and not have his or her classes interrupted is for that child to be vaccinated. If that child cannot be vaccinated, the best way to ensure a good school year for that child is for that child to wear a mask while in class. You know, we know so much more today than we knew when this pandemic started. We've had a whole school year of experience in seeing how well the masks work in class. And that has shown us that when children are wearing masks in the classroom, the virus rarely spreads there. And now, in addition to that tool, we also have the vaccine for those 12 years of age and older. As parents and school officials make decisions about our schools, about their children, it might also be instructive to learn from states that have already started school and are ahead of us in the Delta surge. Brevard Public Schools near Orlando, Florida, started classes last week with masks being optional. They're now reporting more than 470 COVID-19 cases among students and teachers, with more than 1,060 in quarantine. Hillsborough County Public Schools, a district in Tampa, Florida, also started classes last week. And as of yesterday, nearly 5,600 students and 316 district employees were either isolating after testing positive for COVID or in quarantine after being in close proximity with someone who did test positive. Let's go to South Carolina. The biggest school district in South Carolina in Pickens County reopened 2 weeks ago. 9 days later, the school board voted to shift students temporarily to virtual learning after 168 COVID cases among students and staff, and 568 students and staff ended up in quarantine. Here in Ohio, we've had a great deal of experience with kids in masks last school year. We have no experience with kids in school without wearing masks during a pandemic. With the Delta variant producing so many cases today, it will be very difficult to keep it out of the classroom. And it will be impossible, once it's in the classroom, to keep it from spreading unless the students wear masks or are vaccinated. Without something to stop the virus, it will dramatically increase the number of children who will have to quarantine and dramatically decrease the number of schools that can continue in-person learning. Our children simply cannot afford another disrupted school year. We need them in the classroom. And the real tragedy of all of this is it's the children who will suffer when schools shut down. They are the ones who will miss out on their favorite activities, things they enjoy doing. They'll miss out on the classwork that they need. They're the ones who will get further and further behind. And that would not be fair to them. Now, I know some may say, well, look, Mike, we got through last year, so why can't we get through this year? Let me talk about that. Things are fundamentally different this year. Last year, every student wore a mask in the classroom, and it worked. This year, if schools elect not to have students wear masks, not to require that, things will sadly be a lot different. We're in a very precarious time. We have a very high rate of spread in all of our counties, all 88 counties. With previous variants, one person would usually spread it to two people. But as Dr. Vanderhoff has told you, the Delta variant spreads from one person, not to two, but to 5. This is a whole different ballgame. I think what is most important right now is protecting our children and keeping them in school where they're safe, where they belong, and where they need to be. And so to all those who are making decisions right now about our schools, if you're not requiring masks, please, please, please think about this again. At the very least, consider doing it for the next few weeks. The next few weeks when we know the virus spread level will be very high. You can always go back to no mask once the virus spread is reduced. With increasing numbers of new COVID cases and hospitalizations, this is the time to take precautions, not the time to take them away. Finally, to our Ohio parents, let me speak again to you directly. If your child's school does not require a mask, you still have the right to have your child wear a mask. We want our kids in school. We want them to play sports or to be in the band, in the choir, on the debate team. We want them to be learning. We want our kids to be healthy and happy and to have a semblance of a normal school year this year. Ultimately, the best way to do that, the best way to prevent them from missing school or their activities due either to quarantining or becoming ill with COVID, the best way to protect them is to send them to school with a mask, and if they're age 12 or older, to get them vaccinated just as soon as you can. Let me now turn to Dr. Vanderhoff.
Thank you, Governor. I want to remind everyone that COVID-19 is not the common cold. This is not a virus that you can pretty much ignore, but rather a virus that has the real capability of causing lasting harm, lasting damage. COVID-19 can make people of any age very sick, landing them in the hospital or the ICU, and can cause otherwise healthy children to develop MIS-C, a life-threatening condition causing inflammation of multiple vital organs. And the problems with COVID can last long beyond your initial infection with COVID. Indeed, some COVID-19 survivors suffer long-term injury to vital organs, including their lungs and their heart. Some have blood clots and other blood vessel problems. Some are so-called long haulers who report symptoms that last for months after they test positive for COVID-19, including shortness of breath, tiredness, brain fog, and other problems, including even the loss of smell. As of today, COVID-19 has landed more than 63,000 Ohioans in the hospital. These are our friends, our neighbors, our teachers, our coaches, our coworkers. Sadly, it has also killed more than 20,000. Now, while we know and have known for some time that COVID-19 is serious, it's clear that the Delta virus is even more serious. As the governor noted, the Delta variant is more contagious and can make you sicker quicker. Delta spreads like wildfire, and it clearly seeks out anyone who is unvaccinated. And now it is also clearly the dominant strain in Ohio, driving the troubling increases that we are currently seeing and will continue to see in COVID-19 cases and hospitalizations. Now, we monitor activity of all variants, including Delta, very closely through genomic surveillance. This is something that is performed on a subset of the PCR tests, those tests that retain enough sample and enough viral load to go through the more complex analysis of genomic sampling. And alarmingly, the most recent period for which we have complete and reliable data, July 18th to the 31st, the Delta variant and its sublineages made up almost 90% of all of our detections. That means we can safely assume that the cases that we are seeing now in Ohio are almost certainly cases driven by the Delta variant. Now, we've said that the Delta variant is more contagious, and it certainly is more contagious than previous strains. Not only is it more contagious than the strain that preceded it, the Alpha variant, or also known as the UK variant, that variant was more contagious than the one it preceded. Delta is now more contagious, as I've said before, than the common cold or the flu, with one big difference. It is much more harmful than either of those. Multiple scientific reports suggest that patients who become ill with Delta have a much higher likelihood of needing hospitalization and requiring care in the ICU, and sadly, a higher risk of dying. As the governor noted, there is mounting evidence that the viral load for patients who are infected with Delta can be significantly higher than what we have seen with other variants, which simply means that the virus is making many, many more copies of itself when it gets into our bodies. And that likely explains in large part why so many doctors are observing that Delta makes people sicker quicker. But Delta isn't just dangerous for adults. While children are indeed certainly less likely than adults to get severely ill from COVID-19 and the Delta variant, they're not invincible, and they most certainly can and do become ill. Indeed, our children's hospitals continue to see tragic cases of previously healthy children struck down by this virus and now requiring intensive medical care. And of course, whether we are talking about children or adults, when someone becomes infected with this virus, they can, of course, now spread it to other people and pass on that risk of becoming severely ill. The bottom line is that COVID is a very bad virus, even for our children. Without question, vaccinations are our very best protection against COVID-19. In schools, we recommend that everyone who is eligible, students, staff, teachers, coaches, everyone, get vaccinated if you're eligible. For those who can't get vaccinated, masks layered with other prevention strategies, including distancing, are a part of our proven strategy for staying well, even in the face of COVID-19. As the governor noted, masks in school work, and we know this from experience. Last year, masking, social distancing, good ventilation, and good hand hygiene practices, along with vaccination of our teachers and staff, ensured that through the spring we had a very safe environment in nearly all of our schools and uninterrupted academic and extracurricular experiences for so many of Ohio's students. Ohio's goal is to keep K through 12 students in school, in person, 5 days a week. In-person learning is very important for the cognitive, social, and emotional development of our children. And we know it can be conducted safely even in the face of COVID-19, particularly when schools employ layered prevention strategies, including the key elements of vaccination, masking, and social distancing. Governor?
We're ready for questions. Thank you, Dr. Vanderhoff.
Governor, first question today is from Joe Ingles at Ohio Public Radio.
Hi, Joe.
Hi. I wanted to ask you about breakthrough COVID. Ohio is only reporting breakthrough COVID when it causes hospitalizations and deaths. But we know people who have been vaccinated are getting milder cases of COVID. Massachusetts, Minnesota, Michigan, West Virginia, Indiana, those are just some of the states that are reporting breakthrough COVID at the case level. Further, it appears there isn't contact tracing in place in Ohio to warn people who've been exposed to breakthrough COVID to prevent spread. And since even mild cases of COVID can cause serious disruptions for schools and businesses, and maybe even lead to infecting someone who cannot handle COVID as easily, why isn't the state tracking breakthrough COVID at the case level?
Dr. Vanderhoff?
Yes, thank you, Governor. Well, I've addressed this question before. And first, it's important to recognize that these vaccines are really designed and have been from the beginning to protect us from serious illness, including hospitalization and death from COVID-19. And that we've expected from the beginning that there would be some ability for people who are vaccinated to develop asymptomatic or mild to moderate illness. And indeed, that is the case. That's part of the design of this kind of virus, this kind of vaccine working against this type of virus. So we have followed the CDC in considering breakthrough cases to be those that result in hospitalization or death. Also, when you think about this from an information or data gathering point of view, it is much more reliable to look at those endpoints of hospitalization and death, endpoints which really and truly tell us whether the vaccination is doing what it was designed to do or not. And that is the reason that Ohio has taken the approach we've taken.
Next question is from Dan DeRose at WOIO in Cleveland.
Good afternoon, Dr. Vanderhoff and Governor DeWine. Governor, the legislature has taken away your ability to mandate masks, to mandate closings. At what point, and we've seen you very mild-mannered throughout this entire year and a half, at what point do you throw your hands up and say, there is nothing I can do but get on here and give the facts and ask people to wear a mask and ask people to get vaccinated, and even that doesn't seem to work? You are supposed to be the protector of Ohioans, and they've taken away your ability to do that.
You know, Dan, I believe that people generally make rational decisions if they're given the facts and if they see the whole picture. So I scheduled this press conference today. As you know, we've stopped doing regular COVID press conferences. But I told our team I wanted to do a press conference today. And the reason we're doing a press conference today is because the situation has dramatically changed from the last time we did a press conference, which was 10 days ago. What has changed? Well, kids are now going back to school as we expected. Second, we are seeing a dramatic increase in the number of cases, and with no indication that it's going to slow down yet. So of all the times to be seeing this increase, this is a bad time for it to occur. And so I thought it was important to lay out, here's what the numbers are. We are at a very high rate in every single county.
Recording
in the state of
stopped.
Ohio. You cannot hide from this. There is no place you can go to hide from it. I don't care what county you live in. And if you look at these numbers, what is the most stark, what is the most shocking, is that over half of us are now vaccinated. So we are, with some exceptions, but not many, the people vaccinated are not getting it. So these numbers are coming out of only half the population. These high numbers are coming out of half the population, which just shows you how very contagious it is. I felt it was important to remind people, last year, when your children were in school, they were wearing masks. This year, when your children go to school, if I can judge by what I'm reading in the newspaper, many schools, at least at this point, are not planning on requiring masks. So therefore, we're going to have this perfect storm. And it's at a high rate, much more contagious, and now kids are no longer protected in the classroom with wearing masks, which we have shown is very good at blocking the virus. So it is a perfect storm. It's coming together. And I have an obligation to warn the people of the state of Ohio. I have an obligation to look into this camera and tell the parents of the state of Ohio, if your child is going to school and is not vaccinated and is not wearing a mask, no matter where you are in Ohio, your child is at risk. And even if your child gets it and you say, well, you know, it wasn't too bad, you're still in risk of that child being out of class for a long period of time. And you're at risk of other kids being out of class. And you're further at risk of your school getting to the point where they just can't function and they have to go remote for a period of time. I think the one thing that we all agree on after going through last year when we were trying to battle this and we didn't have the vaccine, and really at the beginning didn't fully understand how powerful the masks were. I think what we have learned from that is those masks did in fact work. Today, without that, for those schools who are making the decision to go back and not wear a mask, I want to make sure they understand what the danger is. And I think that our goal should be to keep kids in the classroom. You keep kids in the classroom by having those that can be vaccinated, those that are old enough, and by having everybody else wear a mask, or having everybody in the classroom wear a mask. That's how we slow this down. That's how we keep kids in the classroom.
Next question is from Chelsea Sick at WKEF in Dayton.
Hi there, thanks for having this today. So I'm going to go back to those breakthrough cases. Clark and Preble County health departments tell us they track every breakthrough case, not just hospitalizations and deaths. Do you see the value in this? Is this something other counties should be doing for more data?
Yeah, let me just say something right now. Out of the first three questions, and I have great respect for all of you, the first three questions, two of them have been about breakthrough, and that's fine. You know, we can go back and forth whether or not the state should be tracking breakthrough cases when people don't go to the hospital. And I will have that discussion with Dr. Vanderhoff, and I'll have it with the health department. But the people we should be worried about are the people who are not vaccinated, the people who are going to the hospitals, the people who are getting deathly sick. So, you know, we spend a lot of time talking about there's breakthrough cases, which simply means that somebody who has been vaccinated ended up getting the virus, but yet we were told by the professionals that was going to occur. And knowing how many end up in the hospital, I think, is very, very important. Knowing up how many of those die are very, very important, because it gives you the ability to balance the risk. I'll see if there's a way that we can come up with this data, but it's not going to change what we do. I don't know that it's going to change what any Ohioan does, but we'll take a look at it and take a look at that. So Dr. Vanderhoff, I don't know if you want to add.
Thank you, Governor. Thank you, Governor. I think that for many, and it's understandable, there is a degree of misunderstanding about how these vaccines work. Vaccines against the kind of virus that we're talking about help protect you from having that virus get into your organs and into your body and cause a very bad infection that could make you seriously ill or land you in the hospital. However, they can't protect you from the virus being able to, at first, get into your nose. Once the virus gets there, though, these vaccines have done a very good job of preparing your immune system to recognize that the enemy is there, mobilize the troops to move in and take care of it. And they continue to demonstrate an incredible ability to do that. Now, they are so good at doing it that even in the vast majority of cases that have been examined across the country, they're even preventing people from developing those mild cases. That's an extraordinary level of performance. So while I understand the question, it's really not telling us anything about whether these vaccines are working or not. What tells us whether the vaccines are doing what they're designed to do is whether we are seeing severe cases of hospitalization and death. And we have said that from the beginning. So we should not get distracted by seeing that there are some instances where the vaccines are allowing people to develop mild illness because we knew that would occur from the beginning. It's also, I might add, extremely difficult to get reliable data because not everyone who develops a mild illness even realizes it, goes to get tested, et cetera. But I'll tell you this, when people get sick enough to land in the hospital or sick enough that unfortunately they pass away, we know about each and every one of those cases. So I continue to agree with the CDC, as do most medical experts and clinicians around the country, that this is the right way to evaluate the effectiveness of these vaccines.
Next question is from Steve Albritton at WLWT in Cincinnati.
Hi, Governor. Hi, Dr. Vanderhoff. Thanks for doing this today. Question for each of you. Governor, I know we've been at this for a while, especially with vaccinations. Have we reached the saturation point where if somebody's not going to get vaccinated, they're just not going to, and we're going to have to find a way to be living with COVID for the foreseeable future? And for Dr. Vanderhoff, what's the state of our hospitals? Are we accepting out-of-state ICU patients? Is there any concern that we might have to stop elective procedures again? Thank you both.
Yeah, look, great question. Let me let Bruce, you want to take the second one first?
Certainly, Governor. Thank you. So our hospitals are, of course, very busy, but they are not at a state where they are overwhelmed. We have we're still in a state where we have good capacity. Our hospitals have not been reporting that we are at a stage where we need to defer elective surgery, et cetera. You might recall that our hospitals also have a very sophisticated network of sharing both information about their current state of activity and working together to ensure that if a given hospital is facing a challenge or a crisis, they have the ability to help shift the load and work together to ensure that patients are covered. Having said that, and I meet with them once a week, we are not at that level at this stage, but we continue to monitor very, very closely.
Your first question, no, we think that can continue to grow. In fact, we've seen a significant increase in the number of people getting vaccinated. I'll go back to what I said at the beginning. I think people are rational. They make rational decisions, and what they're seeing in their communities are people getting sick, and they're seeing this spread, and they're hearing about what's going on in other states with the Delta, and they're hearing about what's going on in this state. And as a direct result, I mean, I can't prove that's why the numbers are up, but I think the numbers are up because of people are seeing what the Delta variant is in fact doing. So we can continue to grow these numbers. Look, we're not growing them as fast as I would like. I would like to see 30, 40,000 a day instead of 10,000 a day. But they're continuing to go up, and every day we get more people vaccinated, we have more and more people who are safe.
Next question is from Adrienne Robbins at WCMH in Columbus.
Governor, thank you for taking our questions today. Lawmakers are set to come back from summer break, some as early as next week, with the House Health Committee holding a hearing on a bill that would ban vaccine mandates. At the same time, other lawmakers have talked about banning mask mandates in schools. What do you say to people who are hearing one thing from their representative and see what the Republican lawmakers are pushing at the State House, but then hear a different message from you?
Well, I guess I'm kind of surprised that a member of the General Assembly would think that we should pass a law to take the authority away from a hospital to decide how to keep their patients safe, because that's really what this is all about. Or that we should pass a law and tell our school districts, we don't like what you're doing and you can't do that. So it's just goes against local control, and so I'm surprised by that. And certainly, as bills that I've looked at, I'm certainly not in favor of doing that.
Next question is from Jim Province at the Toledo Blade.
Hi again, Governor.
Hey, Jim.
Even under current law, you could issue a statewide order on at least a temporary basis. Would you consider doing that in the case of a serious outbreak in schools, or would that be something that would also be left up to local school officials to decide?
Well, Jim, I think that, part of governing is knowing where you are in history. We're a year and a half almost into this. I think there's a real desire by the people of the state of Ohio to make their own decisions. And so what I'm doing today is trying to continue what we started a year and a half ago, and that is to give people the best information we have as we have it. And this is new information. It is spreading at a very fast rate. And I know that local schools are still making decisions. I saw last night several schools had changed their mind about what to do. And so I felt that today was, with this new information that we have, it was important for me to talk directly to the people of the state of Ohio and to tell them, exactly where we are. But I think at this point, the clear preference of the people of the state, certainly the vast majority of people, is with what we're seeing now is for them to make their own decisions. And today we're trying to give them the most information that we can so they can make those decisions.
Next question is from Spencer Hickey at Hannah News Service.
Thank you. For the governor, a slightly different topic, but given the events of this weekend, could you discuss the state's ability and willingness to bring in refugees from Afghanistan and any role Ohio-based military personnel may play?
Well, as far as our military, any role for our military outside Ohio, of course, that would have to come from the federal authorities. So for our military to play any role in that, so we could not, do anything outside the state of Ohio without the president, without the chain of command as far as the military. Look, I think that as we look at the tragedy that we saw unfolding on our TV screens, we have to be concerned about those Afghans who have been on our side, who have worked for the U.S., and because of that association, might be in a very precarious situation because of the Taliban, and the Taliban now taking over. So I think that is something, again, I'm the governor, not a senator, not a representative, not the president, but as a citizen, I think that's something that we should be concerned with. For the United States to have credibility in the future, we have to be able to take care of people who have taken care of us, who fought alongside us, and who have worked for us. And so, a group of people that are probably, and again, federal authorities would know more than I do, our intel people would know more, but Afghans who are at serious risk now. And those are the people who I'm very concerned about.
Next question is from Titus Wu at the Columbus Dispatch.
Hi, Governor. One, I just wanted to clarify that. Are you urging school boards to input mask mandates? And two, you mentioned the importance of increasing vaccinations in order to combat Delta variant. How do you suggest school boards do that? Like maybe a vaccine mandate, or what other ways?
No, I don't suggest a vaccine mandate by any unit of government. I think this is individuals have to make those choices. I think I was pretty clear. If I was in a local school board, the way to protect those kids is clear. The way to keep those kids in class is clear. the evidence is overwhelming, and that is more than vaccinated, the better. Again, that's an individual choice. We have some schools in the state who have, worked with their local health departments to provide the opportunity, it's only the opportunity, for vaccinations over the summer. We have some school districts that have certainly have done that. As far as the masking, I think the evidence is clear. That's how we can keep kids in school this year. It worked last year. The masking worked exceedingly well. And again, it's a perfect storm right now. And if a school board or a school district or superintendent says, I'm not going to commit to mask all year, we're not asking them to do that. But, while these numbers are as high as they are today, it just is the most prudent thing to do to ensure that those kids can stay in class. There's no guarantees in life, but it dramatically increases the odds that they will be able to stay in class.
Next question is from Jess Harden at MahoningMatters.com.
Hi, Governor.
Hey, Jess.
You've repeatedly pointed to the success of masking in schools last year, but both you and Dr. Vanderhoff have consistently explained that the Delta variant's increased transmission rate makes this surge so much more contagious. But when masks worked in the classroom, we were dealing with a less contagious virus. Do you trust that masks will be enough to curb COVID spread in classrooms, especially with young students who are unable to be vaccinated?
Well, I think that's a great question. I'm going to let the doctor answer that. Just maybe a general comment. Those masks certainly are better than not having masks on. How it's going to impact with the Delta variant in a classroom, it's certainly going to be less spread if you have the mask on. But you make a valid point, I think, that this is certainly more contagious. Doctor?
Yeah, I think it's a very, very good question. I agree with the governor's answer. I can add a few things to that. While Delta certainly is more infectious, and while we know it has the ability to increase the viral load, we also know that it's still a droplet virus. It still has the dependency. Once it leaves your body, it doesn't survive unless it's in a droplet or micro droplet of moisture. Once that is gone, it fractures, it doesn't work. So a mask will still have a very significant blocking function in terms of helping to reduce spread and create a safer environment. I had one other thing. There's a very encouraging study. It's related to this that came out of Oxford University within the past few weeks. And it was looking at a related issue of safety in schools in the United Kingdom during Delta. And while their focus was really on can testing play a role in helping schools understand the situation in the schools and keep kids in school, it was in the context of masking. And it appears from that study and my review of that study that masking continued to play a very important role in allowing schools to conduct business safely.
Next question is from Luis Gill at Ohio Latino Television.
Hello, Governor. Here we are again.
Afternoon. Good to see you.
Thank you, Governor. Thank you for having this. This question could be for Dr. Vanderhoff. And the question will be, are they still studying, the pharmaceutical companies are still creating studies to perhaps make this vaccine stronger, more effective, and perhaps secondary, are they trying to investigate to give this vaccine to kids younger than 12?
Thank you very much. Those are two very good questions, but they're two separate questions. First, I'll take the second question, and that relates to our efforts to prepare a vaccine for children less than 12. And those vaccine trials are looking very carefully at the current vaccines that we have, the mRNA vaccines, specifically the Pfizer vaccine, and running the trials that are necessary to demonstrate both effectiveness and safety. And so those are underway, and we continue to look forward to when those results will be posted and delivered to the FDA in the hope that we will have vaccine availability for that younger age group. So that's the one effort that's going on. Simultaneously, the pharmaceutical companies are looking at vaccines in terms of, do we have an opportunity to tweak them, to enhance them, to take what we know from the genome of these variants and put a different spike protein RNA in the vaccine so that if we do give a booster, perhaps we would have a booster available that was refined or updated to reflect current experience. So that's what's going on scientifically, two important but different efforts.
Next question is from Alex Ebert at Bloomberg.
Good afternoon. This question is for Dr. Vanderhoff. We're seeing in Kentucky that the state is receiving transfer requests to take patients from Alabama and Mississippi. Is Ohio receiving similar transfer requests to take on patients from overwhelmed states? Thank you for your help and your time.
Well, thank you for that question. So here at the Department of Health, we have not received those kinds of requests directly. Our hospitals may have received some of those requests. However, as you can imagine, transfers from one state to another, particularly when those are not neighboring states, becomes extremely challenging and extremely difficult. So I think that in most circumstances, a response much like Ohio has, where you have a regional intrastate structure for balancing load and managing patients, and then looking toward neighboring states would, to me, make the most sense.
Next question is from John Reed at Gongwer News Service.
Good afternoon, Governor, Dr. Vanderhoff. Since Alex brought up Alabama and Mississippi, in Alabama, you can count the number of open ICU beds on one hand. In Mississippi, they're putting hospital beds in parking garages. I know you said there's a lot of hospital capacity in Ohio now, but are there preparations for if this escalates quickly and there are shortages?
Doctor, you want to take that?
Certainly. Thank you, Governor. The answer to that would be yes. And we have been doing this throughout the pandemic. We never stood down our monitoring, our capability, and our regular interactions with our partners in the hospitals. You may recall that we have a zone structure, and I and others from the Department of Health continue to meet on a weekly basis with our zone leaders. Those zone leaders, in turn, continue to maintain dialogue with the hospitals within their zones to ensure that we are in constant readiness, constantly working with the hospitals to ensure that we're ahead of the game in our planning and preparations. We're very grateful to be where we are now. And in part, there are substantive differences between the situation that Ohio is looking at and the situation that some of our other states in the United States are facing. Not to mention the fact that we have been pursuing our vaccination strategy, I think, with some success. And many of those states that we're referring to have faced a very hot summer with people who are primarily indoors, whereas in the more northern states, we're blessed to have a different weather pattern. So you could almost look at their weather pattern in the summer being a little more like what we experience in the winter in terms of people moving indoors.
Next question is from Haley Nelson at WSYX in Columbus.
Thank you for taking my question. I'm curious, given the rises in hospitalizations and cases we see, Governor, does this have you think about perhaps different ways to try and reach people, additional ways, whether that's different messaging, incentives, et cetera, et cetera? Thank you.
Well, Haley, I think about that every day. We're constantly trying to think how we can reach people, how we can get the facts to people. So yes, I think about that, every single day, and we're always looking for good ideas. So, and we're going to try other things. We're going to continue to try different things. I mean, today's press conference, as I said, just came about because I saw facts changing, situation getting worse, knowing that kids are going back to school, and parents are making decisions, and families are making decisions, and school officials are making decisions. It just seemed like an appropriate time to take this opportunity to get this information out today. But yeah, we continue to look at many different ways to try to reach people.
Next question is from Jeremy Scott at WTNS Radio in Coshocton.
Hi, Governor. Hi, Dr. Vanderhoff. My question is really for Dr. Vanderhoff. One of the biggest points of hesitancy that I've heard when it comes to getting this vaccine is actually from the medical community, and the uncertainty that I've heard about when it comes to how the flu shot and the COVID vaccine will counteract one another. Can you speak to that a little bit? Can you maybe allay some of those fears, or speak to the fact that not enough information is out there one way or the other?
Yeah, thank you. That's a very reasonable question and concern that people may have about the vaccines, and I think that we can put that very much to rest. We've looked at co-administration of vaccines first with an eye towards pediatric vaccines, and health officials have been very clear that in most circumstances it is perfectly safe and effective to co-administer needed vaccines, whether they be the COVID vaccine or some other pediatric vaccines. Secondly, when we look at the flu vaccine, it's a very different vaccine in its design from the COVID-19 vaccine. So we do not believe there to be any reason to expect that a person could not get the COVID vaccine and get the flu vaccine as scheduled. These are not vaccines that conflict with each other. Your immune system is very accustomed to encountering different infections every day, and can really walk and chew gum at the same time.
Governor, next question is the last question for today, and it belongs to Evan Millward of WCPO in Cincinnati.
Thank you. Good afternoon, gentlemen. So as we've been listening to you all to talk this afternoon, some members, Governor, of your own party in the legislature have proposed a law that would ban schools from mandating masks. I guess my question is, what is the disconnect between the governor's office and the legislature, and is there a way to bridge this?
Well, I think that would be a serious mistake. I think that would be a mistake to tell schools that they can't do what the school officials, families, the parents, school board thinks is necessary to protect the students in the classroom, particularly when the evidence is very, very strong that wearing masks, for example, in the classroom has worked exceedingly well. I think it would be a mistake to tell every hospital in the state, we know better than you do about how to protect your patients. When hospitals might require vaccines, they might require masks, they might require all those things. I mean, that's not something I think that we really want to get into in legislating and telling those hospitals how to keep people safe. So I think that would be, a very, very serious mistake. Well, thank everybody. Looks like our time is up, and we hope everybody has a good evening. Thank you very much.